Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Abu Huraira, consultant cardiologist at Arsh Super Specialty. Today, we are here to delving into a silent epidemic that India is combating: heart failure. In India, majority of patients grappling with heart failure are surprisingly young individuals. Its common occurrence in to witness young adults seeking medical assistance for heart failure unlikely. The Western countries where heart failure is predominantly a disease of elderly. Let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get diagnosed of heart failure, they think that the end of their life. The term heart failure can seem frightening, but it simply means heart is struggling to pump blood as efficiently as it should. The ejection fraction or EF measure, however, well your pump bloods. It is the amount of pump out of your heart lower chamber, that is ventricle, with each time it contracts, while normal ejection fraction is around 50 to 70 in a normal individual and typically have a ejection fraction of 30% or lower. Secondly, why so many Indians are affected? Important thing is that the genetics plays an important role. A risk factor that are causes these type of heart failure, that is hypertension, diabetes, obesity, smoking, and habits worsen this epidemic. Moving on to what are the signs? Signs are fatigue, heart palpitation, nausea, shortness of breath, and weakness, loss of appetite, and vomiting. How can we protect? Our heart work incredibly hard to keep us alive. And there are 5 golden rules. That is early detection through blood test, that is NT-proBNP, dietary adjustment to maintain heart health, incorporating daily exercise, practicing stress management technique, quitting alcohol, tobacco, and smoking. And lastly, last point, that is what comes next after heart failure diagnosis. There are numerous treatment. Heart failure medication improves the quality and longevity. Device like biventricular pacing, ICD, heart valve repair and replacement, and the last resort option is transplant. The lifetime risk for congestive heart failure is 1 in 5 for both men and women. One last thing to remember is that awareness and proactive measure are key in combating this silent epidemic. Thank you.